All right. So hello, thank you for attending today and welcome to webinar 3. This is in the systematic review series. This is risk of bias versus critical appraisal. I think in the title of the webinar it said quality assessment, so but that still applies. Selecting the right tools for your systematic reviews. I'm Becca Billings, the systematic reviews coordinator at Lister Hill Library of the Health Sciences. And as part of the systematic review series, a big component that is often overlooked and can be really tricky is the risk of bias quality assessment. So that is why we are having that today. The last webinar of the series is going to be next Wednesday at noon, and I have combined scoping and systematic reviews into that webinar, which we'll see how that goes, just because there are a lot of similarities between those. So hopefully you can come to the next one. If not, these slides and all of the slides have been recorded or are being recorded, and you will also be given all of the PowerPoint slides to these sessions as well. So we'll go ahead and get started. All right, so one thing that is really tricky about risk of bias and critical appraisal tools, as well as quality assessment, is a lot of times people think that these are the same, and they are not. They are pretty different, actually. And while the librarians are methodological experts in the search, when it comes to the quality assessment and the data extraction portions, we're not directly doing them, but we can still guide you on proper tools to use at various stages of the systematic review process. If you have specific questions of different risk of bias tools specifically, you will want to contact your team's methodologist, and they will give you a better overview than what we could as far as the specific types of bias that are involved. So as far as the agenda today goes, we are going to have a short webinar, I think 30 minutes or less with questions, so you can enjoy your breaks. But understanding the difference between what risk of bias is, what critical appraisal tools are, as well as becoming familiar with several of the ROB and critical appraisal tools that are out there. And then we'll talk very briefly, one slide or two each, on how the data extraction process is different from the quality assessment process. And you will see different templates of data extraction or matrix tables and quality assessment tables and covenants. So we'll briefly hit on that today too. And the treat of today is really having access to an awesome repository on not all, but many different quality assessment tools of risk of bias and critical appraisal tools that you have access to. And that has been created by some of our library colleagues. All right, so what is the difference between quality assessment, risk of bias, and critical appraisal? So quality assessment is sometimes used as an umbrella term for risk of bias and critical appraisal, but risk of bias and critical appraisal are quite different. Quality assessment is an interchangeable term for risk of bias tools, and both of these are evaluating the quality of the methodology of the study, where critical appraisal is designed to be used by clinicians or doctors at the bedside to assess an article that they might want to apply to their patient care or setting. And actually, that's in the next poll. Some of you might have used a lot of critical appraisal tools. Those are usually set up as like a checklist, but as far as risk of bias characteristics, ROBs, they don't care about applicability of the study at all. They only care on the methods portion of the study design, and if those methods were conducted in a methodically sound manner. So we do hear about critical appraisal all the time, and critical appraisal is very important in evidence-based practice, evidence-based medicine. But again, if you have questions and they're asking about, can this population be assessed in your hospital in this way, those are going to be your critical appraisal checklists and critical appraisal tools. And those should not be used to assess the methodology of a risk of bias tool. All right. So they are also different in the types of questions that they ask. So you will have the quality assessments, or you will have the critical appraisal tools asking questions about the methodology or even randomization of the population that is involved in the study. But there are some ways that you can identify, and that's one of the ways that you can identify the difference between a critical appraisal checklist versus a risk of bias. Another facet is about how they score. So your risk of bias tools are going to usually have high, low, or unclear on what has been reported about the bias of or a possible bias in the method section. You might have yes, no, or unclear, high, low, unclear, or 0, 1, 2 as far as not reported, low possibility of bias or high possibility of bias or clear evidence of bias. And with risk of bias tools, they're all there to assess individual study designs. So most of the time, your risk of bias tools will have one clear study design that it's focusing on, where critical appraisals do too. So you're going to often have more than one tool if you're doing a systematic review, depending on the types of evidence that you're screening once they've been included in your study. Okay, so quickly, how many of you have used a critical appraisal tool for a patient at the bedside? Or how many of you have used a critical appraisal tool like CASP, CEBM? Those are some of the more common ones. Even as a student, learning about study designs and appraising them. I'm just curious. And which tools did you use? Yes. I have a yes, I have a have not. Right. What about, then I have a second poll, actually. How many of you have used risk of bias tools for systematic reviews? All right, so several haven't used any. We have a couple that have, so a good mix. Basically, the importance of these risk of bias tools in systematic reviews is you want to make sure that you have the best quality systematic reviews possible. So you want to select the right type of bias tool, risk of bias tool, for your systematic review because it will improve the outcomes and the quality of your review. Now, selecting the risk of bias tools and even your critical appraisal tools, you first have to understand what study designs you're working with, and often ahead of time, you'll have in your inclusion and exclusion criteria the types of study designs you plan on working with. So your level 1 systematic reviews are analyzing randomized control trials. So they have very specific risk of bias tools that you'll choose for that. However, there are plenty of other risk of bias tools that can be used. And a lot of times we think of these as in the healthcare field, but plenty of these tools, even though they might be initially focused on healthcare, they can be applied to studies outside of healthcare as well. So just keep that in mind. So as far as common risk of bias and critical appraisal tools, let's check some of those out. Probably the most common one that you'll see is the risk of bias 2.0 Cochrane risk of bias tool. I think about 4 years ago, that was updated from the ROB1 tool. You also have the mixed methods assessment tools, or the MMAT, and then the QualSyst tools. One of my colleagues at Duke, who has created the repository that I'm going to show you, she has said that the MMAT and QualSyst tools are pretty popular to be used for disciplines outside of medicine, and they call it the one tool to rule them all. So if you're looking for a tool that will easily assess multiple study designs, you might want to check with those two first and just see if they work for your team. And of course, with the critical appraisal tools, CASP and CEBM are the most common ones. If you go to their websites, you'll see multiple different critical appraisal tools that you can choose based on, are you trying to assess the quality of a randomized control trial? Are you looking at a cohort study, case control, case study? Are you analyzing a systematic review or a guideline? There are all different types of questions based on that methodology of the study design that you're analyzing that you will then determine based on that what type of appraisal tool you will use. Okay, so tools that are often, because this is such a confusing area, and sometimes you have risk of bias tools that are called critical appraisal in the title. And sometimes they'll say their quality assessment, and if you don't know what that means, it can be really confusing to try and select some of these tools. But CASP, and this is a mistake that I've made, which is another reason I wanted to do this webinar on this particular topic. CASP is so well known, and it's really used a lot within the health sciences for evidence-based medicine. And whenever you're assessing research and healthcare questions and those populations, and while it is great to look at the quality and the applicability of the study, it's not, and it does ask some questions. A lot of the CASP tools will ask some questions about the methodology. They're really focused on applicability of your patient. And can you do this study again? Is it feasible to do this study with your patient at bedside in your hospital setting? So that is a real giveaway that you're looking at a critical appraisal tool instead of a risk of bias tool. But I've made this mistake. There are a lot of systematic reviews that when you see quality assessment, you're thinking, oh, critical appraisal, we're assessing the quality of an article. And they'll choose CASP, which is the critical appraisal tools. So don't feel bad if you have used a wrong tool in a wrong setting. It can be really tricky. Grade is another one that it does ask risk of bias questions, but they're geared towards the outcomes of the full studies, not the individual study methodologies. So it is very helpful for the method's outcomes. It shouldn't be used as the sole ROB tool for all of the studies in your review. And it can be used, but you also want to make sure that you have one or two other tools that are assessing the specific study design itself too. Strobe is another one that's really used a lot for systematic reviews, but this is actually not a risk of bias tool at all. It's an observational reporting guideline, but I do see in the methods of systematic reviews quite often that they'll use Strobe. And it's all part of the process of we're trying to do this right. We're trying to look through all of these resources, and it's very overwhelming with systematic reviews or scoping reviews. So a little bit of training, a little bit of resources and tools can really help with that. Do you have any questions so far? Okay. So the next portion is just a quick difference between data extraction and quality assessment. So this is an example of a data extraction table, or a lot of the nursing students will have a matrix table for their literature review assignments. And your data extraction tables are really helpful for not just systematic reviews, but literature reviews and scoping reviews as well. But basically, it is a tool, and in this setting, a tool for systematic reviews, where you're collecting in a systematic way all of the essential information that you're wanting to know about your final included studies, that you will then take and synthesize for your review. So the types of questions that are often asked in the data extraction table, and it depends, of course, on your research question. You'll have the author and the year information. You'll have information about the population, maybe demographics, as far as sometimes you might be focusing on a specific diagnostic tool that you're comparing. But the thing about the matrix table is it gives you an easy viewpoint of comparing and contrasting all of the included studies so that you can find discrepancies, gaps in the literature, or similarities about the studies. And it makes it easier to then synthesize everything in the results. Often, I would consider, as far as the columns, you want to be pretty specific. And this is something that your team should have organized at the beginning of your systematic review process in your protocol or your plan for your review. So it's like, why are you doing this review? What information are you trying to gather about each of the included studies? Oftentimes you'll have stuff about the method section or themes, strengths and weaknesses of the study, and then maybe what the aim of the study was and conclusions, or outcomes, I should say. And then in Covenants, you'll have that data extraction template that you can build out. That's basically what this is. Next, you have an example. I just Googled this image, but you have an example of how you would report risk of bias for included studies. Now, you only do this for systematic reviews. You do this for rapid reviews and umbrella reviews. You don't have this level being done with your literature reviews, scoping reviews, integrative reviews. And this is really assessing the likelihood or least likely possibility that what was done in the study methods has any type of bias. And if it's not reported, that's also a red flag, even though it's yellow. But if they're not reporting it, what they've done, you wonder about the quality of the overall paper and what they might not be reporting. So the questions, you have that 3-point scale or scoring system. So you have that low risk of bias, which will be a green box. High risk of bias is red, and unclear risk of bias is going to be yellow. Sometimes you might see other variations of those colors, but they're specifically asking about random sequence generation, the allocation of concealment, blinding of participants, and more. So here are the different types of bias that these tools will assess. And since I'm not the study design methodologist expert, you're going to want to consult your team member who is on your review, and they will be able to give you more information about all of this. But I did want to at least have some of the bias examples in the slides so that you could refer back to it. And then this is the standard scoring system that you will see. And this is also going to give you a better idea that it's a risk of bias tool, not a critical appraisal tool that's usually a checklist and has a lot of like fill in the blank answers. Okay, so now it's time for the treat of today. This is the risk of bias tool, or actually, this is the quality assessment repository. So one thing that the librarians are good at is getting all of the evidence or information for you and organizing it in a way that you can use it later and apply it to however you need. So this is a really awesome tool, and I learned about this in the spring, which is also another reason why I wanted to do this session today. Usually the librarians don't dip their toes in the risk of bias tool portion, but we can guide you on where to find them and some tips on how to decide which tool to select. So our library colleagues, Layla Ledbetter and Steph Hendren, they are medical librarians at Duke University, and they have created an ongoing repository that you can download, and they've made it open so that we can share it with all of our researchers. I've talked to them a couple times with my own risk of bias questions. They're awesome. We're on MLA Systematic Review Caucus with them as well. But this repository has 85 tools. Actually, I think they're now in the 3 digits. But basically, you have a list of these tools that are either critical appraisal, risk of bias, or quality assessment tools. They've provided the name of the tool, the citation on how it was developed, whether it's a validated tool or not, the link to the tool, and they also have certain notes that are really helpful. So they'll say things like, this repository or this tool was originally created for this, or it's better suited for a student assessment, not a risk of bias tool for systematic reviews. So they have some really great features. Now, whenever we send the slides, I'm not going to send this tool. I have the link to it so you can download it so they get credit for it. But as far as how to use the tool, you can download the spreadsheet, and oh, the link didn't show up as pretty here. But the tool list is organized alphabetically, and then in column F, there is a study design list. So you can select the specific study designs that you are working with and then narrow it down to see what study tools would be best suited for assessing those study designs. So I'm going to go into it. Here. And I'll just show you how you get in. This is indexed or uploaded, whatever, in the Open Science Framework. All right, so you just copy in the link and it gives all the information from Layla and Steph and their instructions. It was last updated in April. Sorry, big gulp. But just go into the files, and this is where you're going to download the repository. So it has like 1,800 something downloads, which are probably by a lot of librarians. But basically, you have to download it in order for it to save the features. I've downloaded it several times. So we're going to open it. And then you can save it to your desktop. Here we go. So I'm going to give you a little tour. And if you need me to zoom in, I can. It's really hard to show Excel spreadsheets. But you have all of these tools. You have the alphabetical list, the tool name, tool description, which is really helpful. It'll say this contains 20 items. It's a critical appraisal tool. Amstar, developed to assess non-randomized control trials, in addition to RCTs. But you get the citation. Now, the citation about the tool is important because it gives you an idea on why this tool was created, how it works, and how you should be reporting and using the tool, and why it's made in the way that it is. You have a link to the tool, and then in column E, really helpful, you have the distinction between if it's a quality assessment tool, a critical appraisal tool, or risk of bias, which is really helpful. Then you have the study designs that this tool is intended to analyze. You have a column for whether or not this tool has been validated. And then you have some tools that are not fully validated. They might be in phase 1 or phase 2. So ideally, if you don't have a tool for your particular study design, you could always try and use one that might not be validated, but it might be in phase 2 where it's almost ready. But that could be a limitation in your study that you report. And then the notes and feedback portions are really helpful because this is where they say, hey, don't use this for a systematic review. This was actually intended for this. And they might give you a little quick history of something. So let me zoom out. All right. So the last thing that's kind of the bread and butter of this repository is this drop-down tool. So in column F under study design type, I always select all. For a while, I was trying to choose one over here and apply the filter, and it kept selecting all of these boxes, and I couldn't get it to work. Just deselect the filter and choose the type of study that you are looking to conduct a risk of bias assessment on. So we'll just do experimental studies and then apply the filter, and it will give you a list of those specific tools. Now, one thing, I kept having to download this tool because I kept saving the file after I filtered, and then it kind of messes it up. So don't ever save it, like save it to your desktop, but then after you start filtering for your study designs, don't save that. You'll just have to re-download it. So for instance, you have grade here. It says classifies the quality of evidence in one of 4 levels, high or very low, and offers 2 grades of recommendations, strong and weak. So then you can click into the tool. It's quality assessment tool, risk of bias tool. And that's this Cochrane epoch effect practice and organizational care. But it's just really helpful. And then you can go in and just clear this filter in column F again. Clear, and it'll show all of the tools again, the full list. So then let's just do one for qualitative studies and maybe quasi-experimental. You can apply those filters. There's not as many for the quality assessment one. It's kind of, you would think that the qualitative studies are kind of tricky. And they're a little bit more simplistic and the questions that they ask about the methodology, just because of the nature of them. But you can still assess the risk of bias. So you can scroll through and then see these are for qualitative studies or quasi-experimental, etc. So it makes it really helpful. Now, let me exit out of this. A few tips about selecting the tools. So the librarians are trained to be very careful about saying, yes, this is a good tool, you should use this one or not. It's not our choice. So we will send you resources, and then we encourage you to make that decision on your own as a team. So the first thing to do is explore the test. So use this repository, limit to a couple risk of bias tools, explore them as a team, take 5 articles that you know are relevant to your review, and practice assessing the risk of bias. You want to pick a tool that's validated for your study design, and you want to pick a tool that has clear instructions. But in the end, pick a tool that is easy for you to use that you like. And you'll pick like probably 2 to 3 tools. So if you have multiple study designs, I should say. Other places that you can find risk of bias tools or information about a specific risk of bias tools, of course, it's going to be Cochrane guideline, but they are very limited and they focus specifically on intervention-based systematic reviews. So theirs are pretty much going to be randomized control trials, and they're very much focused specifically in healthcare. You also have the National Academies Press. They have a manual as well that gives information on risk of bias in systematic reviews, but it doesn't assume that you're working on a systematic review, just RCTs. Another tool that I've linked here is Latitude's Network Library. It will take you directly to about 40 tools currently, so it doesn't have as many, but it is still available to you, and you can check out. I think it has some information on different phases of validation that tools are in as well. And then, of course, many of the library research guides on systematic reviews will have information about risk of bias. Now, keep in mind, though, one thing that's confusing is still many of them will group them with that CASP or some of the critical appraisal tools as well. And just note that they are different. But hopefully this repository will help. Do you have any questions? And you can contact me anytime. And quick credit, thanks so much to Layla Ledbetter and Steph Hendren for that repository. They are open to adding more tools all the time, and they are happy to do some investigating as well. So if there is a study design type that's not there that you need, we can always reach out to them as well. All right, that is all. Oh.
There's a chat question.
Good. Let's see. Thank you, guys. All right. Do we always have to visually represent results of our ROB assessments? Is it allowable to provide a summary narrative of the risk of bias assessment? I often see the charts, so that's the difference with the systematic reviews. I'm not sure, but I think it would be easier to have a graph or a chart with those 3 or 4 scoring guides. But with the data extraction tables, you're synthesizing that information too. I would just look for examples of systematic reviews that have they should have the quality assessment, and just see how they've presented those results on the quality assessment. So I don't know. I would use the graph probably, just because it's visually easier to quickly scan and understand and present the information. Just like you have with Prisma, the Prisma flow chart, you'll have a lot more tables and charts in a systematic review for that reason. But you'll still probably be using some type of narrative anyway to speak about that information. I would just look at examples of systematic reviews and see if any have that information that didn't use a graph. But I don't know if that helps. Probably not, but that's all I have on that. I'm not sure. All right, everyone. Anything else? No problem. All righty, everyone. Well, 30 minutes. So I hope you enjoy the rest of your lunch break if y'all are taking lunch, and please use that repository. I thought it was really cool, and thank you all for attending today. The last session is next week on Wednesday at noon. So hopefully we'll see you there. So y'all have a wonderful day. Thank you.
Good job.